Welcome to the first section of Joint Health and Degenerative Disease, Joint Anatomy. In the next 10 minutes, you will have a joint anatomy review to better explain osteoarthritis multimodal therapies and spark owner conversations. Osteoarthritis consequences within the joint and outside the joint will demonstrate why prevention and acting early is essential for quality of life. And you will discover why pain limits mobility and so much more. Great mobility is due to the full range of motion within the various joints of the body. Ball and socket joints, like the hip, allow for rotation, while hinge, like the knee joint, allows for bending and straightening. Highlighted is the cranial cruciate ligament, one of the most common ligaments to rupture in veterinary medicine. The ends of bones are covered by articular cartilage and surrounded by synovial fluid. Cartilage is primarily composed of complex extracellular matrix consisting of collagen, proteoglycans, and water. This matrix is the spongy shock absorber. The shock absorbing properties are dependent on the high water content. The water content is maintained by proteoglycan molecules. These are large molecular weight structures with a protein core. The extracellular matrix provides shock absorption. Attached to proteoglycan protein core are chains of glycosaminoglycan, or GAG, molecules. GAGs carry a negative charge and attract water. GAGs can be categorized into four main groups: heparin sulfate, chondroitin sulfate, keratin sulfate, and hyaluronin. Hyaluronin is also known as hyaluronic acid. It is the largest glycosaminoglycan and contains glucosamine. It is concentrated in the synovial fluid and is largely responsible for its viscosity. Chondrocytes maintain the cartilage matrix by continuously replenishing the collagen and proteoglycans. The synovial membrane has synoviocytes, cells that remove debris from the joint fluid and produce hyaluronic acid. The synovial membrane provides lubrication, hydration, and nutrition for the articular cartilage. Osteoarthritis is often described as a vicious circle. It is the most common cause of chronic pain in dogs. The circle is pain, inactivity, and deconditioning. Osteoarthritis equals cartilage damage. Cartilage damage leads to inflammation. Additional consequences include loss of extracellular matrix and chondrocytes, inflammatory response of the synovium, critical changes in proteoglycan ratios within the cartilage matrix and synovial fluid. As GAG molecules decrease, so does water content. Cartilage thins and is less able to provide cushioning. Inflammation is caused by cartilaginous destruction. It progresses and is aggravated by the release of cytokines, catabolic enzymes, and inflammatory chemical mediators. This leads to pain, which reduces activity and mobility and can lead to weight gain. Pain has global consequences. Weight gain will cause new damage or aggravate existing lesions, thus perpetuating the cycle of osteoarthritis. Without intervention, osteoarthritis will continue to progress and cause life-altering consequences: pain, loss of mobility, behavior changes, etc. Joint damage is a vicious cycle of pain. Degeneration of the normal structures within a joint. Pain causes reduced use of the joint and the limb. Surrounding muscles, ligaments, and tendons become weak. The body compensates elsewhere, which causes more pain. The brain becomes more aware of the constant pain and magnifies it. Why is osteoarthritis so important? It is a disabling, non-curable, and progressive disease. The initial focus is on moving joints, but eventually it impacts more than mobility, such as appetite, mood, social interaction, and behavior. It is a major cause of euthanasia due to loss of quality of life. Osteoarthritis affects 80% of dogs and 90% of cats over 5 years of age. Without treatment, osteoarthritis will continue to progress, causing a decreased mobility and activity, weight gain, and increased pain. The best approach to addressing osteoarthritis is multimodal: appropriate analgesic pharmaceuticals and supplements, weight loss, and tailored rehabilitative exercise. Thank you for joining us for the first segment of Joint Health. Next up, we'll talk about recognizing the signs of pain.